I thought it would be appropriate to bring in Dr. London today. We have had a 100-year pandemic, as we all know, and hopefully he can shed some light on a quick review of what all we've been able to do. I think we have one of the best health departments in the nation. And so I'm so thrilled that he's here, and then also give us an update on vaccine and vaccination rollout as we proceed into 2021. Dr. London.
Well, good morning, Chair, and happy holidays to everyone. And you've done a dangerous thing by asking me to give a brief update on COVID, but I will do my very best. And I think also in line with your desire to make this a positive meeting, I think there are a lot of positives that we can celebrate right now. The first thing I want to say, though, that to you as the elected representatives of the people of Kent County, I want you to know that you have in your staff at the health department, at administration, throughout the county, you have really some extraordinary people who have given so much of their lives this year, who, when the public health and safety of the people of Kent County is threatened, they take it personally. They take it very personally. This has energized them. They have taken this on as a crusade to protect lives in Kent County, and I'm very proud of them, and I know you are as well. I'm not going to spend time. I don't have the time to go through all of the things that we have done or all the things that we're doing. But everything from contact tracing to isolation centers to communications to testing. This has been a huge lift this year, and I'm just going to briefly go over where we stand now with the epidemiology. Then I'm going to spend a little bit more time talking about vaccines and where we're at going forward, if that's okay with you. So where are we right now as we look at our current epidemiology? We've had over 38,000 diagnosed cases here in Kent County over the course of this pandemic. What you're looking at here is what we call an epi curve. It is the line graph along with the bars showing our new cases day over day over the course of this year. You'll see we had the virus first arriving back in April, late March and April. We had that flatten the curve moment back in April, May, and you can see that we did that, and the people of Kent County did that by following those precautions and doing what they can to make it difficult for this virus to spread. And then you see in the fall, what happened is what we thought would happen with the more ideal environment for respiratory airborne virus to spread. We had that big second wave, which thankfully it appears has peaked right around mid to late November. It peaked at about 700 new cases per day. Since that time, we've seen our 7-day rolling average come down to about half of that number. Right now, we're at 330 new cases per day, which is a huge positive development for us. And that means that our hospitals aren't feeling the same stress day over day as they were back in November. Right now in Kent County, we have a little less than 300 people that are COVID positive inpatient hospitalizations. A month ago, that was 400 or maybe a little more than that. So those numbers are coming down day over day. And that's very important because about 10% of the people who are hospitalized don't survive. Here's our positivity rate. And as you probably have heard many times this year, positivity is the percentage of the tests that we conduct that come back positive for COVID-19. Back during that peak, back in mid-November, we were seeing about 17, 18% of all these tests come back positive. That's starting to come down now. Over the past 7 days, we're seeing an average of 11.8% of those tests being positive. That's still way too high. We'd like to see that positivity rate 3% or less, but we'll certainly take the great progress that we have seen over the past several weeks. We are, however, still in a very vulnerable position. We know there are many community and family gatherings and things like that that are going to happen over the next few weeks. We know we're still in the darkest, and entering the coldest part of the winter, very dry conditions, all of which are very favorable for the transmission of an airborne virus. And then the most sober of our measurements is our deaths. right now we're at a total of 443 deaths reported to the Kent County Health Department. We're seeing an average right now of about 5.86 deaths per day. That's a little bit better than where we were at a few weeks ago. However, it's much worse than where we were at during the summer, where we were seeing about 1 death every 3 to 4 days. Now we're seeing close to 6 reported to us every day. The peak in deaths always follows the peak in cases by about 3 or 4 weeks. So what we're seeing right now is a result of that surge that we were seeing back in mid-November. Hopefully, as the new cases continue to decline, we'll see over the course of the next 3 or 4 weeks, the number of cases, the number of deaths on a daily basis decline as well. Our case mortality, which is the percentage of diagnosed cases that don't make it, that don't survive, is at 1.2%. And that's a number that's actually much lower than the statewide average or mortality rate, which is over 3%. And that's a much lower number, that 1.2%, than in many counties our size or larger across the country. And so that's a huge credit to everyone in Kent County, all of our partners who have done their job, and the people of Kent County in making testing available, because the earlier people can get diagnosed, and if we can do the contact tracing and stop this from spreading, we can give people the information they need to better protect themselves. And by doing that, we also keep those hospitals in a position to provide the best care possible so that they don't become overwhelmed and we see excess mortality because of that. So this is the real good news though. And this is really astounding that over the course of less than 10 months, we went from having a virus that was completely novel to us to having a virus that we have a vaccine for. And I think that there's a lot of credit to organizations and levels of government and industries and researchers across the country and across the world. And I'm extraordinarily proud that a Michigan-based company, Pfizer, was the first to cross that finish line. And there are many other great companies that are doing research that can bring more products like this, and hopefully even better products, vaccine products, to us in the future. But the fact that we have a vaccine before the year is over is an extraordinary accomplishment. Vaccines usually take years upon years to bring to the community, not 10 months. So 8 things I want you to know about a vaccine in our planning. The first is that the safety of these COVID-19 vaccines is our top priority for all of us at the pharmaceutical companies, at the FDA, all the way down through the hospitals and the health departments. We need to make sure that the people have confidence that these vaccines are safe, and I believe they are. I believe that vaccines have some of the very best safety performance of any products that are produced, and the data really supports that. Many vaccines are being developed and tested. Some are going to be ready before others. So there are actually over 100 vaccine products around the globe that are being developed right now. All of them have a little bit different science behind them. They have a little bit different profile in terms of their storage and their handling. And hopefully, as we get more of those products available, we'll be able to push the vaccine into the community, into many more providers quickly. At least at first, these vaccines are going to be used under an emergency use authorization through the FDA. And I think that we've all heard a lot about emergency use authorizations. That does not mean that shortcuts were made in the safety review of those products. It simply means that many of the steps were happening concurrently, and that they were made a highest priority for review. And in fact, in many cases, the size of the populations that are used for that phase 3 clinical trial are increased dramatically in order to make up for the expedited process. The only thing we're really missing is the longitudinal analyses of these vaccines over years. There's going to be a limited supply for a while, and we really encourage people to be patient. It's going to take a while before vaccine is readily available to the community. We'd like to have an awful lot more than what we have right now. In fact, As of this moment, we don't have any at the Kent County Health Department. I'm hoping that changes today. Our hospitals receive theirs, but there is going to be a limited supply for a while, and we need to do what we can to recognize that. There are groups that are prioritized for receiving it first. I'll talk about that in a few moments. The vaccines may not be recommended for children. Right now, the Pfizer vaccine is recommended for ages 16 and up. And the reason that it's not recommended for children at this time is simply because children were not included in that phase 3 clinical phase. There is no reason for us to think that the vaccines are unsafe for children. We just have an even higher level of standard when it comes to children safety. And because the children, their body, their physiology works a little bit different than the adult body, we want to make sure that we're extra careful there. Cost will not be an obstacle to getting vaccine. At the Kent County Health Department and anywhere else, we do bill insurance. However, if someone doesn't have insurance or if they forgot their insurance information, we're not charging. We can charge all those unreimbursed costs to our HRSA fund for reimbursement at the end. So collecting cash or taking payment at our clinic is not what we're going to do. In addition to being an impediment to getting people vaccinated, it would simply create one more point of contact, one more customer encounter that adds risk to everyone involved. And we will be sharing information about COVID and the vaccines as that information becomes more and more available, and as more vaccines become available. And we'll be doing that through our county website and also a website that we've created with our partners. So we have a vision along with the state that we're going to be prepared, and we are, to safely and efficiently distribute the COVID-19 vaccine as it becomes available, and that we're going to be doing tracking and monitoring to measure how far we've come as a community. If there are groups within our community that aren't getting care, aren't getting access, we're going to identify that very early and make sure that that's resolved quickly. Transparency and public trust are going to be essential to this and have been essential throughout our process so far. Having equitable access to the vaccine so that people don't have a disparate level of access to it. This isn't going to be based on privilege or on any other resources that people have. We're going to do our very best to make it available to everyone in the community. And ensuring proper engagement of stakeholders and community partners is critical as well. And to that point, we have already been doing that. We have had engagement with what we call a race, equity, and inclusion group, making sure that we don't make mistakes, repeat the mistakes of the past. Many racial and ethnic groups have historic trauma from abuses in the past. Tuskegee syphilis experiments, for example, is still in the memory of many people, where public health and government agencies abused the rights of people. We don't want that to be the case here. That's not going to be the case here. Our plan needs to be the community's plan. They have had and will continue to have a role in deciding how and where these vaccines and programs are rolled out so that they have confidence and can share that confidence with their neighbors. A church leader group has been engaged since the springtime. That's important because communities of faith are so important to us here in Kent County. They're gathering places, so that's an issue. But also people look to their faith leaders for confidence and for trust. And so by making sure that they're part of our team, we can help to move that trust and bring everyone into that trusting relationship. Our hospitals, our long-term care providers, community stakeholders group. We have people on our staff who've been focused on being community connectors with residents and with neighborhood groups. We've been involved with the Kent Intermediate School District from the very beginning, and also having frequent meetings with business. And by doing all of these things, we're doing our best to make sure that everyone is part of the planning. And I'm really proud of this slide and the work that our team has done. Lori Latham has been a key leader here. We've created something called the West Michigan Vaccine Collaborative in partnership with all of these organizations. When I say we, I mean, all of the people and organizations on this slide, our neighboring health departments, our hospitals here in the Kent County area, Cherry Health, groups of affiliates of providers, pharmacies, Kelvin, Michigan State, Grand Valley, are all part of this collaborative because we recognized early on that it's important for us to have a similar message, but it's even more important for us to have the same message and to have a point of contact, a homeroom, if you will, for information for the community. And that's what we've created in a website called vaccinatewestmi.com. I would encourage everyone to look at that website on their own time. That website is providing all kinds of great information about the vaccines, about where to get them. As they become available, we're going to be providing tools and information so people can determine if their time for access has come, and where they can go to get the vaccine, where they can register. They can register when it becomes available. They'll be able to register right through our website. So it'll make life a lot more simple when it comes to vaccination. And I think this level of partnership is indicative to the culture we have in West Michigan of working together. There's a lot of competitors in this room and on the slide, but when it comes to this issue, they've all made it very clear that we need to beat COVID-19 together as quickly as possible, and we can only do that together because none of our organizations have it within our ability to do this individually. So the Pfizer vaccine, and this is really a fantastic product. It's a very sophisticated vaccine. Some people have had concerns about live virus vaccines. Others have concerns about vaccines that are used with development using daughter cell lines. There are lots of reasons why people have concerns, some founded, some not so founded. But one thing you need to know about the Pfizer vaccine, it doesn't use any of that. It uses a technology called a messenger RNA vaccine, where it's taking a piece of code, a piece of genetic code from the virus, the code for what's called the spike protein. It's basically the key that the virus has to break into your cells, to hijack your cells, to become factories for making more virus. And so by giving, in this vaccine, by providing that code, it enables your body to identify that code, to produce just the spike protein, not the virus itself, but just that spike protein in order to familiarize your immune system with that. And so by doing so, your immune system can recognize that spike protein when it enters your body. And so if in the future that virus with that spike protein enters, your immune system recognizes it and neutralizes it quickly. But it is a complicated vaccine, a lot more complicated than other vaccines. I'm not going to go through this whole slide, but this is just kind of getting under the dashboard of what Pfizer has created for us. And it's a sophisticated, it's a Ferrari of vaccines, it really is. But it has to be maintained very carefully. It needs to be held at extreme cold temperatures, ultra cold temperatures, less than 70 degrees, negative 70 Celsius. Once it is brought to room temperature, it has to be used within 6 days or 6 hours. It has to be diluted with a diluent before it's used. It is only provided in large doses. So when we receive it, we're receiving at least 1,000 doses at a time, which is much greater than other vaccines, and it requires a 2-dose series. So 21 days after the first vaccine, that second one has to be administered. So again, it's a beautiful vaccine, it really is, but it is high maintenance as well. We're looking forward to the Moderna vaccine. That is being reviewed right now by the FDA for an emergency use authorization. I hope that within the next couple of weeks that will be available to us. That also, as we look under the hood, it's not quite as complicated as the Pfizer vaccine. It's not a Ferrari, but it sure is a Corvette. It's another beautiful vaccine, but high maintenance, not the kind that you want to that has the same kind of user friendliness that many of our other vaccines have. This one also has to be held at very cold temperatures, not, however, ultra cold. This one is about -20 Celsius. We have a little bit more time to use that vaccine, the Moderna vaccine, once it is brought to room temperature. It also requires a 2-dose series, but this is 28 days apart, so we have a little more time there as well. So how much vaccine is being distributed? Right now, the state has the ability to allocate a little over 170,000 doses of the Pfizer vaccine. Most of that is going to 60 hospitals across the state. Most of those hospitals have already received their deliveries and have begun the process of vaccinating their highest priority staff. There are 12 health departments across the state that have the ability to receive the Pfizer vaccine because those 12 health departments, including Kent County, have ultra cold freezers. And in total, those health departments will be receiving about 40,000 of those doses. We're going to be receiving about 2,000 of those doses here in Kent County. The Moderna vaccine hopefully will start its distribution in about a week from now. There were about 70 hospitals that did not have the same ability to receive the Pfizer vaccine. So they're going to be prioritized for the Moderna vaccine. And the rest of the health departments around the state, mostly in rural areas that don't have the same infrastructure, the same ultra cold freezing capacity that we have, those other health departments will be receiving the Moderna vaccine starting here in a week or so. And then after that, all health departments can get either or both of those vaccines. So at that time, we'll be asking for both the Moderna and the Pfizer vaccine so we can maximize the amount of vaccine that we're receiving here. It also gives us a little bit more flexibility in the places and in the ways and the times that we can arrange our clinics. Lots of questions about the priority groups. There are 3 general phases to the rollout of the vaccine. Phase 1 are those highly vulnerable populations and frontline healthcare workers. Phase 2 is the general population, and phase 3 will be the long-term maintenance of COVID vaccine years to come. But I want to talk a little bit about phase 1 because that's where we're at right now. Within phase 1, we have several groups. We have phase 1A, B, and C. And within phase 1, which I'm showing on this slide, there are 3 priority tiers. So we have phase 1A1, which is EMS, our medical first responders, the general medical emergency department, intensive care units, and our Kent County Health Department vaccinating teams. And you'll see at the health department, we're working to get vaccinated our own vaccination clinic teams, along with the medical first responders with EMS, and the hospitals are working with their staff. Once that's completed, which should take probably a couple of weeks, we'll be moving to priority 2, which is going to be the skilled nursing facilities, those long-term homes, homes for the aged, the adult foster care, assisted living facilities, home health care workers. And at this point, it's going to be a mixed responsibility between the health department, the hospitals, CVS and Walgreens pharmacies are also brought on. They're going to be doing mobile vaccination as well as us in the hospitals, trying to get to those most vulnerable populations living in those congregate settings. And then priority 3 within phase 1A are the other healthcare workers. So now we're talking about specialists, we're talking about oral surgeons, dentists, people doing outpatient care and indirect patient care. And that will be the health department and the hospitals providing vaccination clinics for those other healthcare workers. And then we'll move into phases 1B and 1C. 1B gets us into some more of the other essential workforces. The K through 12 teachers and staff, childcare providers, other first responders, people working in the food supply chain, people working in other essential supply chains, our other vulnerable congregate living settings like homeless shelters, our jail, other congregate settings for childcare or for adult protective services. And that is going to be a much larger group. We hope to get through that in about a month, and then moving into phase 1C, which is where we really start getting into a significant portion of the community. Here's where we have people aged 65 and older, and people with those chronic health conditions, which are linked to the more severe outcomes with COVID-19. So as you can imagine, once we get to phase 1C, we're now talking probably close to about 20% of our population, maybe more, that are going to be eligible for vaccination at that stage. Here is a general time frame to give you an idea about what we're looking at. So phase 1A will be happening over the course of the next about month. As we enter phase B, which is those other essential healthcare workers, the teachers, the first responders, and so forth, that'll take probably another month to a month and a half. So we're looking at by the time we get to the end of February, early March, being through phase 1B. And then 1C will probably begin in March. And that's that first very large group with the 65 and older and the people with underlying health conditions. And then phase 2, which is general population, will begin, we hope, about a month after that. So about April. Don't hold me to these timelines precisely. A lot of this, in fact, the majority of this depends on the availability of vaccine. And it also depends on the diversity of vaccine. It's great that we have the Pfizer vaccine now and that the Moderna vaccine is coming on quickly. But for us really to get through phase 1C and phase 2 quickly, we need other vaccine products available as well. We're doing an awful lot right now to prepare for these clinics. You can imagine all of the behind the scenes stuff that's happening with all of the logistics and training staff, not just the people who are giving the shots, but for every person who's giving a shot, there is a support system of people doing registration, of doing safety, of doing disinfection. They're on site, of mixing the diluent with the vaccine and prepping. There is a whole workforce behind each frontline vaccinator, if you will. And we have been doing, and we continue to train and prep for that. In fact, we're doing some of our last walkthroughs this morning in anticipation that we'll be receiving vaccine today. We had expected to receive our first delivery on Tuesday. That was pushed back to today. I expect that we're going to receive 1,950 doses of the Pfizer vaccine today. We will have a very small clinic tomorrow for our Kent County Health Department frontline staff to best prepare them for having larger clinics. And then we're planning clinics for other frontline staff at the health department and our EMS medical first responders starting next week and going through the last week of December. So of course we've got holidays in there, and it's going to be maybe a difficult time to get to people, but I think it's a high priority for EMS and for us to get this done before the end of this month with those groups. And then, as I mentioned before, we do plan to reorder Pfizer and the Moderna products to the maximum amounts that the state will allow us to do that, and to keep doing that on an ongoing basis. The clinics that we're holding during phases 1A and 1B will be at the health department at 700 Fuller. For those of you who are familiar with that building, we'll be using the garden level, the basement level. We have repurposed and designated that whole area as a clinic. It's one large clinic right now where there is a circular flow of motion. There's very little to no cross traffic of people in that area, lots of space. We've learned a lot over the course of the year from other clinics and from other situations, including the election, where clerks like our own did a fantastic job in creating elections where people went to polling stations that were also done in a safe way, where people moved quickly from one door to through the process to the next door, and we're able to do that without being sites where more infection was spread. So we're very confident that we can handle hundreds of people a day during these phases 1A and 1B, where we'll have a smaller group of people, and we can do that in a safe and efficient way. Happy to announce that within the last week, we have received our mobile units that we've been talking about that were purchased with CARES Act money. We have these two beautiful 24-foot Ford mobile units that are going to be very useful for us during all of these phases. These will empower us to have strike teams that we can send to congregate care settings where maybe people are less mobile. They can't come to us, but we can go to them, other vulnerable population groups. And then we can use them on an ongoing basis, making sure that we have a presence in neighborhoods and in small communities that might have limited transportation, maybe access is challenging for them. We can go to where they are and bring vaccine to them. We're very excited about this, and we hope to use these for vaccination and flu clinics and lead testing and all kinds of great things in the years to come. So as we move to phase 1C and phase 2, which are those very large parts of the response where the population that's eligible will grow very quickly, we are looking right now at large venue mass vaccination clinics. We are having conversations with the leaders of those organizations, of those large venues. I don't want to mention them by name right now, but you can use your imagination. There are a number of very large venues with large parking structures or parking lots in our community that can be used and have willing participation from their leadership to help us to do this, to make sure that we have the venues accessible and at our available to us to make sure that we can roll this out as effectively as possible. We really want to get to a point where we're using what we call a push strategy, where instead of pulling the community to us at a health department or a hospital location, we're pushing vaccine to pharmacies, to doctors' offices, to clinics throughout the community, so that we have a decentralized approach where it becomes as available as the flu shot is to all of you right now. The key to making that happen is going to be having more vaccine products available that don't require the sort of extraordinary maintenance that the Pfizer and the Moderna vaccines have, some more durable vaccines. We believe those are coming. In fact, I know they're coming. Having those available in those many locations throughout the community is going to be very key to us in 1C and in phase 2. And as I mentioned, we're going to continue to make this information available to the community at vaccinatewestmi.com. So please stay tuned to that. I have a number of kind of common questions that we're receiving. And Chair Bolter, I can kind of run through, I've got about 7 or 8 of these right now. I can run through these quickly right now if you'd like, or I can stop now and take questions.
Go quickly, that'd be great.
I'm sorry, was that proceed or pause?
Yeah, if you could go quickly, that'd be great.
So how many shots will I need? For these 2 vaccines, they require a 2-dose regimen. The Pfizer requires a 2nd dose on day 21, thereabout, and Moderna at day 28. However, we believe that the AstraZeneca vaccine and others that are coming will only be a 1-shot routine. Lots of questions about side effects. The actual occurrence of side effects, both in the phase 3 clinical trials And what we're seeing right now is very low, 4% or less of people during the phase 3 trial reported side effects. The vast majority of those were injection site discomfort or other just pain on the site or slight fever, and very low there. If I had COVID, do I still need the vaccine? The answer to that is probably yes. We don't know how long the vaccine is, the acquired immunity from natural infection, how long that is going to remain effective. And so what we do know is that immunity from the vaccine lasts a lot longer than actually acquired immunity. When I get the vaccine, can I wear a mask? Or should I wear a mask? We're going to recommend people continue to wear a mask because the vaccines, while they are 90% effective or greater, they are not perfect. And so we're going to continue to recommend people wear a mask until we get through this pandemic. Yes, wear a mask. And I can share these slides with everyone so you can look at these answers in more detail.
Yeah, Adam, and I'm wondering if you can definitely share that presentation so that we can share it to our constituents and any ways that we can post it. I just think it's great information that we can, pick out to the community.
Absolutely. And before I take any questions, I do want to say on behalf of all of us at the Kent County Health Department, a huge thank you to Commissioners Voorhees, Vaughn, Talon, and Melton. You've all been tremendous champions for public health, and we greatly appreciate your service to our county. So thank you.